we're trying to get a handle in all the other areas of my chronic illness battle, and I want to do the same for my chronic pain. You know, I just want to improve my quality of life. On our adventure.
Oh, you're freezing cold here.
Good Tuesday morning, y'all. So, if you watched yesterday's vlog, you'll know that Harlow has a slight fascination for Judd's toy helicopter, and I'm just looking over the vlog before uploading it this morning, and she heard the toy helicopter in the video, so she like ran over here to look for it. It was so cute. Do you like the toy helicopter? You know, that's not a dog toy, right? I love you, Hippo. So are y'all aware of Harlow's, like, other fascination with the Swiffer? Can I have that? Thanks. I don't know what it is, but she, like, enjoys it. Thanks. All right, I'm just gonna use this to clean, all right, Harlow? Just gonna get some dusting done before Judd wakes up, because we're leaving today for another doctor appointment, and while we're gone I want to run the Roomba, so that means you got to clean up your toys too. I have dusted. All right, so I'm seeing a new doctor today. He is a pain management doctor recommended to me by another Ehlers-Danlos syndrome warrior, so hopefully he is knowledgeable. But I have seen a pain management doctor once before and had a bad experience, which has kind of deterred me from pursuing pain management again. But I don't want to let it stop me anymore, because one of my favorite sayings is not all doctors are created equally. And the thing is, I can't take narcotics for my chronic pain, and I explain it more in this video, but basically it slows down motility for me even more, and I obviously already have a problem with that, so my medical team has determined narcotics are just not a good option for me. So that leaves me pretty limited on what I can take, and right now I'm only using a heating pad and rest, and I feel like I could use more options, because dealing with pain every single day can really wear on you. Like this morning, I woke up and one of my ribs was dislocated, which is pretty common for me due to my EDS, but it hurts. So going in to see this new doctor to hopefully give me some more options and pain relief to help manage my chronic pain better. All right, Hippo, we're almost ready to go. Harlow, clean up. Clean up. Good girl. Go on. Oh. You having trouble there? Clean up. Where are you going? There you go. Good girl. Good dog. Harlow, go get your ball. So we actually played some indoor fetch for like 20 minutes this morning. You still want to go, don't you? Harlow, give. We'll play a little bit more, but we gotta go. Gotta go to work, and I gotta go to the doctor. You're so good. Harlow, give. Give. One more throw. Oh, she almost hit the wall. Careful, pup. Good girl, Harlow. You're so cute.
Best thing about owning a Roomba is turning this thing on and going out.
I think the best thing about having the Roomba is vacuuming without passing out. Because of my POTS, no matter how slowly or carefully I vacuumed, I would always pass out. And that's the main reason we got the Roomba. So
Right.
I was telling the people the main reason we got the Roomba is because I would always pass out while vacuuming. So it's been we had to save for like ever to afford it, but it was well worth it. Roomba has been started and we are on the way to my appointment. It's a long drive. Thanks for taking me, babe.
Yeah.
And I'm a little apprehensive about how it's gonna go, but I am cautiously optimistic. Well, we had a super thorough evaluation with the nurse. Now we're just waiting for the doctor. Got my supporters over there. Harlow's being good as per usual. The really long drive over here gave me quite the neck ache, so I'm in the right place for seeing a pain management doctor. I told the nurse, she's like, what do you want to get out of this visit? It's like, well, we're trying to get a handle on all the other areas of my chronic illness battle, and I want to do the same for my chronic pain. You know, I just want to improve my quality of life. And she said, you're in the right place, so ready to do this. I love my husband because he drove the car up right to the door with the awning so I didn't get wet in the rain. You're amazing.
I know.
Thank you, babe. So the appointment went way better than I expected. I got so much out of this appointment. I'm almost speechless, but I'm never speechless because I talk a lot. What did you think about it, babe?
He was a really good doctor.
He really was. I know. I'm shocked. And he knew about Ehlers-Danlos syndrome. I said EDS and I was like, oh, sorry, do you know what that is? He's like, yep. I was like, wow, this is already going really well. So of course I will tell you all about it when we get home. Well, it's late and it's dinner time and Judd is hungry, so we made a detour.
At one of our favorite barbecue places in Plant City. And
Batteries?
Jack's alarm started going off for a pump to change batteries. I think it was loud. I thought it was like a fire alarm or something.
It was not that loud.
That was loud.
I was like, I just changed the batteries on the pump for my infusion, and yeah, we are still a long way from home, and we were passing by this on
Now it's going off again.
so we decided to stop at one of our favorite barbecue places, and Judd said he's starving, so I don't have to order from the kids menu. He said he'll finish whatever I don't eat. How was it, babe?
Very good.
Good. I got a sandwich, and I won't eat all this. Judd said he's gonna eat the rest of it, but I vented my stomach, so I should be able to eat more than usual, which is awesome.
Oh my god, Jack was able to finish everything after I gave her my plate. And I took hers.
I did not eat as much as I thought I would. I literally just took a few bites, but that is okay because I actually ate half of a cucumber this morning, and cucumbers are healthier for you, so it's all right, right?
Mostly water.
Cucumbers are mostly water, which is why they're a safe food for me and I can digest them, but
I was telling about how you eat cucumbers, but you won't eat a pickle.
yeah, I eat cucumbers, but I won't eat pickles. I don't know. I don't like pickles, but I do like cucumbers. And I ate one today, so that is an accomplishment. She slobbered on me. I love you. Well, we're going home. Usually it's too loud in there for me and I need my headphones, but it was pretty, oh, it's probably because it's a weekday, not a weekend. So it's not as busy. You were so great today, Harlow. I'm proud of you. Ready to head home, babe?
Yup.
All right, we'll see y'all at home. Well, today was a productive day, but we spent a lot of it in the car, which always exacerbates my pain. So I've got the heating pad on my neck and upper back, and Harlow is giving me some deep pressure therapy on my left hip, which is where she uses her weight and body heat to apply pressure to help alleviate my pain. And now I will tell y'all about my doctor's appointment. The appointment went so well. This doctor was extremely knowledgeable and understanding and kind, and something he said that helped me feel very validated is he said he knows that people with EDS and who deal with chronic pain in general, he understands that we may be struggling a lot on the inside, but we can appear fine on the outside. We may be smiling and laughing and still dealing with a great deal of pain anyways. It's just that we've learned to function with it because we deal with pain every day. And he said, even though this is our normal, that doesn't make it okay. Even though we've learned to deal with a subluxed hip and continue on with our day, that doesn't make the pain okay. So he wants to help me improve my pain, to improve my quality of life, and that really helped me feel validated, and I really appreciated that. We talked about past treatments I've tried, and we agreed I'd pick up massage therapy again because it helped me. I've tried things like low-dose naltrexone and it didn't work at all, and I can't take narcotics. He totally understands that and agrees that it's not a good option for me. He then asked what my most problematic area was and what I'd like to focus on, and I told him, well, my neck, and then probably my ribs and my hips. So we're gonna focus on my neck. He asked me to move my neck, and literally that's how far forward I can go before I have pain, and that's how far back. And he said it's really the occipital areas and there's inflammation. So we're going to be doing injections in my neck with Toradol, which is a non-steroid anti-inflammatory drug that I take to help with the inflammation. And because of using Toradol instead of a steroid, he said it'll help with not breaking down the connective tissue, which is very important for the Ehlers-Danlos syndrome. He's hoping that will give me relief for a few weeks, maybe even a few months, because in the past I've done a nerve block with Mayo Clinic, but they used lidocaine, and the lidocaine only lasted a few hours on me. I had relief from my pain for a few hours. It was a glorious few hours, but only a few hours of relief is not enough justification to get the shot again. But using the Toradol may extend the period of relief. I trust him to do this despite my neck instability, because he's very, very knowledgeable in Ehlers-Danlos syndrome and how to do this properly without harming me. That's the only reason I trust him to do it. Now, there is another part to this, and I'm really interested to see how I respond. For the procedure, I'm going to be sedated, and the type of anesthetic my doctor is going to use is ketamine, which is a really safe and it's a really common form of anesthetic. Ketamine has been shown to really help chronic pain patients because it resets the central nervous system and how it responds to pain. And it's still considered experimental for chronic pain treatment, so insurance companies generally tend to not cover it for chronic pain treatment alone. But since I need anesthesia for the procedure anyways, insurance will cover it because, like I said, it's a common and safe anesthetic. So I'm going to be getting benefits from the injections and potential results from the ketamine anesthesia. My doctor expects me to see immediate results from the ketamine, and it should last a few months, but of course it may not work. And at the very worst, it doesn't work and I get relief from the injections, but the injections may not work. With every treatment, there is the risk that it may not work. There are risks of side effects and poor results, but you know, we weighed the pros and cons and we picked the best plan of action for me. And even if we share the same diagnosis, know that treatment plans may vary because chronic illness affects everybody differently. But I am very confident in what we chose to do for myself, and I'm confident in this doctor's ability to help me live a better life by getting my pain under control. And we're doing this procedure at the end of the month. I'm looking forward to getting some relief. So I'm often asked about medical marijuana, and I haven't ever tried it, and we're not currently pursuing it. And this is why. I would only ever take legal options, and in the state of Florida, it's very restrictive. Plus, I don't want THC whatsoever because I personally don't want to experience a high. And then there's the CBD component like CBD oil, but CBD has been known to lower blood pressure, and I already have a pretty significant issue with that. I actually have to take medication every day to keep my blood pressure up. So right now, it's not something we're currently pursuing. Maybe in the future we will revisit it. And I know medical marijuana in its many various forms has helped a lot of people with many various symptoms. And if it works for you, that is amazing. I'm really, really happy for you. But it's not for me right now. We are going to pursue other options to help control my symptoms, and I'm perfectly content with that. Tired. Been a long day. But it was a really good appointment, right?
It went really well.
I think we're going to see some good results. I'm sorry, I filled your days off with lots of doctor's appointments.
That's okay. That's what you do when you love somebody.
I love you. Well, we're tired, so we're going to go to sleep. And with that, we'll say goodnight.
Thanks for joining us on our adventure.
I got all jumbled.
Look at my big hand can block your face.